Was this a simple clerical mistake, or did the federal government just get caught trying to stack the deck for the pharmaceutical industry? The Department of Health and Human Services just made a massive, last-minute U-turn that has everyone in Washington questioning who is really pulling the strings behind our national vaccine policy. We are talking about a move that could have fundamentally altered how medical recommendations are made for 330 million Americans. Before we continue, if you want to stay on top of everything happening in U.S. politics, hit that subscribe button right now and leave a like. It really helps this channel grow and ensures you never miss the truth behind the headlines. On Monday, a bombshell notice was prepared for the Federal Register. The Department of Health and Human Services, or HHS, officially withdrew an amended charter for one of the most powerful groups you've probably never heard of, the Advisory Committee on Immunization Practices, commonly known as ACIP. Now, for those who don't follow the inner workings of the CDC and HHS, ACIP is the group that decides which vaccines are added to the official schedules for children and adults. Their recommendations often lead directly to state mandates, insurance coverage requirements, and billions of dollars in revenue for drug manufacturers. The story began when HHS quietly filed an amended charter for this committee. This wasn't just a routine update. The amendment sought to loosen eligibility requirements for the people who sit on this board. In the world of high-level government health policy, loosening eligibility is a massive red flag. It often means lowering the bar for expertise or, more controversially, opening the door for individuals who might have previously been disqualified due to conflicts of interest or a lack of specific clinical experience. However, just as this amendment was about to be set in stone, HHS pulled the plug. In an official notice, the department claimed the withdrawal was due to administrative errors. They stated that the amendment was filed prematurely and contained inaccuracies regarding the committee's structure and the qualifications required for its members. But in the hyperpolarized world of U.S. health policy, many are asking, is administrative error just a convenient excuse for a department that realized it was about to spark a massive public outcry? Let's look at the context here. For the last few years, the process of vaccine approval and recommendation has been under a microscope like never before. Critics have long argued that the revolving door between regulatory agencies and big pharma is too wide. By attempting to change the charter to make it easier for certain individuals to join the panel, HHS was stepping into a minefield. The ACIP consists of 15 voting members who are responsible for making some of the most consequential decisions in modern medicine. When you change the rules about who can sit in those seats, you change the outcome of the votes. What does this actually mean for you? Well, it means the status quo for the ACIP remains for now. The original charter stays in place, keeping the current eligibility requirements intact. But the fact that HHS even attempted to loosen these rules behind the scenes suggests a shift in philosophy within the department. If they had succeeded, we could have seen a committee that is less independent and more susceptible to political or corporate influence. The possible outcomes here are twofold. First, this could embolden oversight committees in Congress to dig deeper into how these charters are written. We are likely to see subpoenas or letters of inquiry from House Republicans who have already made public health transparency a cornerstone of their platform. They want to know exactly what those administrative errors were. Was it a typo, or was it a legal overreach that would have been struck down in court? Second, this move further erodes public trust. At a time when the government is struggling to convince a skeptical public about the transparency of its health decisions, a stealth amendment that gets withdrawn only after it's caught creates a narrative of incompetence or, worse, deception. If the HHS can't handle the paperwork for a charter amendment, how can the public trust them with the complex data behind new medical mandates? The implications are huge. We are seeing a tug-of-war between career bureaucrats who want more flexibility in how they staff these committees and advocates for transparency who want more rigid barriers to prevent bias. By withdrawing this charter, HHS has temporarily retreated, but don't think for a second that this is the end of the story. They will likely come back with a corrected version, and you can bet the language will be scrutinized word for word. Who is affected? Everyone. From parents deciding on their children's healthcare to taxpayers who fund these departments, the composition of the ACIP dictates the direction of American medicine. If the eligibility requirements are weakened, the barrier between independent science and corporate interest becomes dangerously thin. So what do you think about this? Was this an honest clerical error by a busy department, or was this a failed attempt to sneak through a policy change that would have changed public health forever by letting the wrong people into the room? Drop your opinion in the comments below. I read every single one, and I want to know if you think our health agencies are being transparent enough. This situation serves as a stark reminder that in Washington, even the most technical administrative changes can have massive real-world consequences. We will be following this story closely as the new, corrected charter is eventually released. Make sure you stay tuned to this channel for the full breakdown when that happens. The fight over who controls our health policy is just getting started, and we will be here to cover every move.